Doctors means yes, they are the ones who's going to create pain. So that image what the child has, that has to be cleared out. Teeth is not only for the chewing, it also helps in the development of the child. The child needs to have a speech. For a proper speech development, you need to have a teeth.
Amma.
Most people don't choose pediatric dentistry. What pulled you towards it? A child walks into your clinic terrified, crying, refusing to open their mouth. What does behavior management actually look like in this moment? So, most parents assume baby teeth don't matter because they fall out anyway. What's the real cost of that assumption, Dr. Kumar? You've been working together for over 25 years. What's the hardest part about building a business with your spouse?
Our roles are defined. So mine is just the operational part. Of course, can't get into the treatment part, right? So, and his is more of the treatment part. But when Dr. Kumar says this is a new equipment and I want it,
Young dentists today are coming out of college and immediately facing pressure to sell treatments, push procedures, hit revenue targets. How do you teach them to pause? Put the patient first when the entire system around them is saying to do more.
These guys, after finishing 5 years, they still have to start a setup, and they have to again invest lakhs of rupees on a practice, or they have to work under somebody. So that is when the greed part would set in. If a patient walks into you look at these many teeth, and okay, instead of doing a restoration, if I do a root canal, I'm going to make more money. So most of the unethical practices, they would start during that phase.
Flow Bengaluru presents Beyond the Bio. I'm Subhashini Lakshman, and this is our new episode, The Smile Makers, proudly presented by Sahasra Property Capital, because they believe, like we do, the most important investment you can make is in how you think, lead, and live. This is where it gets real. 25 years ago, that's how long today's guests have been building something together. Not a startup, not a brand, not a trend, a practice, a place where children who are terrified of the dentist walk out smiling, where special needs kids get the care that most clinics won't even attempt, where the person running the business side isn't a doctor at all. Dr. Kumar NC is a pediatric dentist, Dean of BGS Global Hospital of Dental Science, and Managing Director of Smile Care Dental Specialty. He's been a Senate member of Rajiv Gandhi University of Health Science and an expert panelist for GlaxoSmithKline and the Indian Dental Association. He's trained generation of dentists to see children differently. And when he's off duty, he's learning keyboard at Bangalore School of Rock. Reshma Kumar runs the operational side of Smile Care. She's the one who has built the systems, managed the team, and kept the clinic growing for over 2 decades. Two people, two very different skill sets, one practice that served generations of families across Bangalore. Dr. Kumar, Reshma, welcome to Beyond the Bio. You've been working with children's teeth for 25 years. Most people don't choose pediatric dentistry. What pulled you towards it? And was there a moment early on that confirmed you would make a right call?
Thank you, Subhashini, for having us here. Initially, when I started, pediatric dentistry was the last in my list to join for my master degree. So after my undergraduation, I started my private practice. So when I was doing my private practice, one thing I realized was, compared to all the patients, the pediatric patients are the most loyal patients, because once they are comfortable with you, they wouldn't want to be seen by anybody else. For any reason, if the child has been taken to any other place, I've seen many patients, when they come back to us, the parents would hide that they have taken the child to somewhere else, but the child wouldn't hide it. So the child would mention that I'd been to this clinic, I didn't like the doctor. So this is one thing that changed my mind. Yes. So the more, if you really want to be committed to the patient and you want the patients to be loyal to, So this is one specialty. So that's when I decided I will join pediatric dentistry. Otherwise, my first choice was always an orthodontist, specialty which corrects the teeth alignment and all that. So, and because in my initial days of practice, I realized, see, pediatric dentistry, you get to treat the child from the time and the child infant from the infant stage till the age of 18. So everything you need to treat the child. So any issues. So you do require special skills.
And you have the history, so it becomes a little easy for you.
Yes,
You
yes.
know who and what you're dealing.
Yes, yes. So that is when I decided, yes, this is the specialty I should be
That's
getting
what
it.
tipped the scale.
Yes, yes.
Okay. So this is what you don't get from a LinkedIn bio.
Yeah. Yes.
You're also learning keyboard at Bangalore School of Rock. What made you want to pick up an instrument at this point of in life? Has it changed how you think about your work?
Uh, to be very frank, I always had the inclination and the passion to learn an instrument, and obviously, one person has been instrumental for pushing me to that. It is the person sitting next to me.
Yeah, I can
So
see it from
yeah.
her smile.
So she's always been pushing me, because for me the timing was always a challenge. So she said, if you really want to learn something, you will always make time for yourself. So that, yeah, so that is when I decided, yes, I want to do this for myself. And with the current time schedule and the work pressure, all that, so I decided, yes, I unluckily I had one teacher who stays in my same apartment, who was ready to teach me. So I'm trying to balance it out, and it will also gives me some amount of relaxation. And with the work pressure, that kind of gives me mental peace, I would say.
You're not a dentist, but you've helped build Smile Care from the ground up. When did you first step into the business, and what was your learning curve like in an industry that wasn't your training?
So yes, I'm from a non-dentist background. Initially, we were in a rented clinic place. So we expanded and we moved to our own place. That's when, and he was working in the college in the morning. So I thought, why don't I help him in the operation part? Something that can
Unburden.
yeah, unburden him. So that's when it's been almost 11, 12 years since I've joined him. And when I asked him and I said, this is what my plan is, so he said, yeah, you're most welcome to do it. Yeah.
Yeah, so you had his support.
Yes.
And I think by then the kids were also
Yeah,
settled.
kids
so you
were all-
had
yeah.
the time to.
Yeah, somehow, because, yeah, the mornings. So I go in the mornings
Mhm.
so that by evenings when the children come back, I'm there for them too. So that's how I
you
manage.
started
Yeah.
working.
Yeah.
I hope it was a pleasant
It
journey
is, it
because
is.
it's something that
Yes,
you were not
she's doing,
trained.
Yeah.
she's doing the balancing act well.
Okay, that is nice. Kumar, you get a lot of brownie points today.
Oh, yeah.
You're
So
answering.
that needs to go for a celebration then.
Yes, yes.
No special permissions.
So we have a doctor who chose children over everything else in dentistry and a partner who learned healthcare management from scratch. Let's get into what actually happens inside Smile Care and why it matters. Dr. Kumar, this question is for you. Let's talk about something most parents don't talk about. A child walks into your clinic terrified, crying, refusing to open their mouth. What does behavior management actually look like in this moment? Walk us through it.
When the child walks to the operatory, so we have a reception area. So in the reception area, see, we usually don't dress up like the doctors. See, for a child, when the child walks in, see, before they come to us, they've already visited the pediatrician. So for them, the experience is either they have taken the child for an injection or a vaccination shot, all that. So they would have had a picture in their mind. Doctors means, yes, they are the ones who's going to create pain. So that image, what the child has, that has to be cleared out. So we would never wear an apron in our practice, especially a periodontist. We will make sure that our clinical area is more colorful, with lot of paintings and all that, and with lot of books for them to ease out the stress and the anxiety in there. So that is in the operative. When they're walking into the clinical area, we don't straight away start with that procedure. So from the time when they're walking, we observe the way the child walks in. And if the child is walking next to the parent, so they are okay. But if the same child is walking behind the parent, we know, yes, they are very anxious, very apprehensive. So our behavior management and assessment of the child would start from there. So we make the child sit on the chair. Once the child sits on the chair, we don't ask what the problem is. We start with the general introduction, like what's your name, even though we know everything. So we just ask them, what's your name, where do you study, which school. We let them settle down, and we ask them, what friend do you have, friends, what games do they play, all these things. See, because so when we take them to the environment where they have already been there, so they are at ease. So then that is how we kind of create a communication. See, in our pediatric practice, the most important thing is having a communication.
And patience, I think.
Yes. So the moment the child starts having a communication, then it becomes easier for us. So that's when the child starts trusting us. So if the same thing, if the child is very fearful, so first we need to clear out the fear and anxiety in them. So after asking all these questions, then they kind of open up. They start having a conversation, and during this entire conversation, we would request the parents not to intervene, not to have a conversation in between, because it has to be always a one-to-one conversation. So if the parents involved in between, the child would always want to respond to the parents than to the dentist, than to us. So we always make sure that the child would always want to have a one-to-one conversation, and it will be just a general conversation we would like to have. It should be just an exploratory visit where the child will have a very pleasant experience. And when they go back, no, we cannot give them any goodies like chocolates and
Yeah,
sweets, all that.
that
we
works against.
yeah, so we usually give some contingent like a balloon, or if the child has been very cooperative, then we give them a smileys. So
Okay.
and every time when we are sending the child, we will always tell them, next time when you come back, there's always a surprise.
Oh, okay.
So the child knows, yes, next time when I come, what is that surprise? So they'll be more into to come back to us.
Okay.
So that is more. It's more like, often it's called as a behavior modification.
Okay.
So the positive behavior has to be reinforced by giving these reinforcement.
Correct.
A negative behavior, because of various reasons, we need to suppress all those things.
So I think it's equal psychological and equal
Yes.
dental
So there
practice
is a
here.
lot of psychological assessment. Then
Yeah.
we get into the behavior management part.
So most parents assume baby teeth don't matter because they fall out anyway. What's the real cost of that assumption, Dr. Kumar?
When it comes to baby teeth, so of all the structures in the human body, your teeth is one structure which is in two sets. So initially you have a primary teeth which is called as a milk teeth. So that usually by the age of 1 year till the age of 12 years it would be there. So between 1 year to 6 years you will have only the milk teeth, and by the age of 6 years the second set of teeth, that is your permanent teeth, would come, and it would serve the rest of the life. So for the parents, they always think, if anything happens to the milk teeth, you will always have the permanent teeth. I will take care of the permanent teeth well. And the second thing is, when the child is taken to a general practitioner or any other specialist other than a pediodontist, so the biggest challenge for the dentist is handling these kids, and especially if the kids are uncooperative. They have absolutely no clue how to handle this. So either they have been misinformed. It's okay. If the child has a pain, give a painkiller. Then you can always come back. If there is a pain, we will think about something else. So, but we periodontists, for the moment the child comes to us, we first before treating the child, we need to treat the parents, because we need to make them understand why is it important to have the milk teeth. Because it's not only, teeth is not only for the chewing. It also helps in the development of the jaws. Without the presence of your milk teeth, your jaw wouldn't develop. So if you are thinking permanent teeth is the most important one than the milk teeth, the child do require a nutrition. Without you grinding your food, how would the child get the nutrition? One. The second one is, the child needs to have a speech. For a proper speech development, you need to have a teeth.
I didn't know that. Teeth is important
Oh,
for speech.
yes.
Okay.
And the third one is most important, and most of the time it goes neglected. That is the emotional factor. See, what the child goes through. See, I'm sure even your kids, when they go to school, the kids always have the habit of comparing the toys or those stationaries, what they have with others. If a child, especially in a preschool, when they go to the Montessori and thing, so when they see other child having good set of teeth, they will always come back to the parent and asking, why is my teeth like this? I've seen quite a few instances like that. So when the child walks into us, first is making the parents aware these milk teeth are important. So once the parents understand the importance of the milk teeth, then the actual treatment for us starts.
So it's not age group of 6 and above that children come to you. It's even young children come.
I have I do get patient infants who are just about 1 month old. You do have, yeah. So you do have something called as a natal and a neonatal teeth. So when the infant is born, either the infant is born with a tooth, especially the lower teeth, or infant will have a tooth erupting within the first 1 month. So these are the especially not exactly a good sign. It's a part. It can be a part of a milk tooth or an additional set of teeth. So it is very difficult for the mother to feed if the child has a tooth within the first 1 month.
Dr. Kumar, you've spoken about how correcting a child's teeth early, something as common as protruding front teeth, can protect them from bullying and change their confidence level completely. Tell us about a case where you saw that play out.
I had a very interesting experience with this. So about a few years back, there was one. I got a family with one a older girl child and a younger boy. So the girl was about 13 or 14 years old, and they had got the girl for a orthodontic treatment for the braces. Orthodontic treatment is for the braces, and the second child was a boy who was about 8 or 9 years old. So when they walked into my operatory, so I looked at the girl child. So I gave my advice, and the boy was just sitting to one of the corner, and he never tried to interact with me. And when I looked at him, so I sensed something is not right. And then I just happened to strike a conversation with him. So because that is the biggest
Challenge.
challenge, and the biggest strength what we as a periodontists we have.
Correct.
So I tried to have a conversation with him. So that's when, so whenever he wanted to answer, he used to either cover his mouth like this and used to
Ah,
speak.
okay.
That's when I realized he had a broken front tooth. So they had taken the child to a different general practitioner. So the doctor had told them at this point of time, because the child was just about 8 years, and they did not know how to handle it. They said when the child becomes about 12 years, so then you can get. So when I made the child sit on the chair for an examination, initially 5 minutes he was just not ready to open his mouth, speak to me. So once I started speaking to him, once he had the confidence, then slowly I told him, I can make your tooth look like how it was before. So I could see the change in his, the expression, the happiness, what he felt. Oh yes, this is what I wanted.
I can be normal.
I can be normal. So I convinced the parents after that. I convinced the parents because parents were not aware of it and what the child was going through. Because most of the times, see, when the kids of that age, when they come back and tell the parents, so this is what they've been bullied. Either they don't want to mention it, or if they mention it also, the parents would say it's okay, take it easy, it's okay, you don't have to take it seriously. And after I convinced the parents, then I treated the child, and from that day onwards, there's always been, he's always the one who tells the parents, yes, I would want to go there. The smallest of the issues, he would say, I would want to come. So this is one thing which I noticed. Yeah, case study I would like to mention.
So, early intervention changes everything, and that's the clinical side. But, Reshma, what does your day actually look like at Smile Care? What are the parts of running a dental clinic that people never see?
So I feel the greatest power that we women have is home running. And I feel anybody who can run a home can run any business. So it was not too different here. Of course, the starting was a little challenging because you have to understand, right, how the whole system works. But it's not very different, but the coordination of the treatment plans, what has to come into that day, the lab work, the consultants being informed, or the patient follow-ups. Those are the challenges that are there. So if that runs smoothly, the minute the doctors come in, the patients come in, everything is ready. And even in terms of holding the assistants, that's the greatest challenge. So every week, suddenly the day is full of patients, and one says, "Sir, I have a cough." So that's when if one person doesn't come, it gets really difficult. That's yeah. So I feel each and every person in the clinic is very important. It's not only the doctors or only the us who run the operational part. No, every single person in the clinic is important.
That's a very important,
Yeah, yeah,
which I think most of us don't realize.
yeah.
We think
Realize,
it's
yeah,
the doctor who is the most. Like in a
yes, yeah.
restaurant, I'm sure there are much more people important than just the chef,
Yeah,
right?
yeah. And even like everything, they have to be trained, right? So
Mhm.
these are all kids who are like PUC passed,
Mm.
or they're in some difficulty that they can't continue their education
Education.
and all that. So when they come in, we in the sense, most of the training is done by him. So they are trained fully. So in case one doesn't come in today, or suddenly says, okay, I have to go back to my village the next day, so it gets really tough for us to again get a new person, train them. And patients don't see this, so they expect everything has to be perfect. From yeah, we do give it, but these are the challenges that goes back in. Sometimes the lab work comes in, and we're like, okay, it doesn't fit properly. Then what do we do? Then again we have to take a measurement and all that and send it back. So there are a lot of challenges like this. The smallest of ones are the ones that really irritate the day. But yeah, it is an everyday process, and you have to get through
So
it.
attrition is not just with the IT people.
Oh.
No.
So this question is to both of you. One of you all can answer this. You've been working together for over 25 years. What's the hardest part about building a business with your spouse? And what's the one thing that's kept it working?
We go with the flow. So at times the flow is more towards her side. So when obviously when she would be a majority, then I'll go with the flow. So it's certain times coming to decision making, all that. So about the operational part of it. So because she handles it, and because for me handling the patient is the big most of my
That
time
is your
goes. Yeah,
focus.
that's
Yeah.
my focus, and I don't want to
Correct.
get into the
Operations.
operations part of it. So that she handles it.
Yeah.
So
When you have a boss, why intervene?
yes, you did. You
No,
got it
another
right.
thing is our roles are defined. So mine is just the operational part. Of course, I can't get into the treatment part, right? So and his is more of the treatment part. But when Dr. Kumar says this is a new equipment and I want it, that's when everything changes. That's the hardest part actually, because these equipments are really
Very
expensive, and of course we want to give the best to the patient. But again, it's a chain reaction actually, wherein the costing differs. We have to start again planning how much the costing goes up to, what are the lab charges. Yeah, everything changes. And when you tell the patient and they're upset,
And
they're
you have
like,
the return of
yeah,
investment. So she comes with that idea, return of
yeah,
investment.
I believe in return of investment,
So
but he believes in giving the best treatment. That is important. But
So
I
Dr.
say,
Kumar likes his new toy shiny.
yeah,
yes,
yes. He likes all the latest toys in his dentistry.
Yeah.
For me, I'm like, what are the returns?
Correct.
And he'll be like, returns? It's going to help me improve my work. And I'm like, no returns. I want returns.
I'm not addicted to the digital part of it, I'm addicted to the equipments part of it.
I
So
know. Okay. So yeah, I think that might create some friction, I'm sure.
oh yes.
It does.
So,
It
but I'm
does.
sure you also have a process that you have
Yes.
arrived at that makes these
Yes.
decisions
See,
very
because
easier.
when I started my practice, I started my practice with a small setup of about 300 square feet with a
Okay.
2 chair, to
Okay.
about 1,600 square feet of practice with 4 chairs with
Okay.
all the consultants. Yeah. So yes, definitely. If we have to build this, so without
Of course.
some amount of friction and agreement and all that, it wouldn't have happened.
Yeah,
And
correct.
luckily, by God's grace, we are able to
Manage it.
manage all that.
And I think that's the easy part of, working with a spouse, because both of you all are affected. So it makes you know that you'll really have to put a lot of thought into it before deciding. It is just not one person, right? So let's zoom out from the clinic now, because Dr. Kumar, you're not only treating patients, you're also shaping the next generation of dentists. You've been on the Senate, the Academic Council, and the Board of Studies at Rajiv Gandhi University of Health Science. From that vantage point, what is the biggest gap in how you train young dentists today?
See, there's a lot of compared to 30 years back, 30 plus years back when I first joined my dental school in the year 90s, early 90s, to now 35 years back. There's been a big shift in the way things have been moving. So right from the education policy which the government is coming up with, so even the university also is bringing a lot of changes, especially the professional courses. So for me, if you want to bring in any changes, so the first change would be at the administrative level. So that is when me being in the university, because Senate is one of the decision-making body. So you could bring in a lot of changes with the kind of curriculum and the teaching process with the students would methodologies and all that. So which the students would go through. We were able to bring in quite a few changes, but obviously with the current generation of kids, so the commitment is not as good as how it used to be a few decades back. So they are more wanting for immediate gratification. So my out of 24 hours, I would want to give only 4 hours. So, but the expectation is for 24 hours. Okay, so that's a big challenge. What I feel. So that's a big gap. We are trying to bridge those gap, and trying to bring in a lot of changes because we are making them accountable. So it is not that no their job is coming, because unlike any other universities, because the moment they join a professional course, especially medical and any other allied courses, you would be handling the patient. Yes. So that is what they need to realize. Okay. So that empathy part will not be there. So we are finding that as a big challenge.
I think no master class or a classroom can teach that, right?
So we are trying to do build that, so that because right from the pre-university they would be straight away jumping into the course treating patients. So we have to make them understand how they have to interact with the patients, how they are supposed to behave, all these things.
Young dentists today are coming out of college and immediately facing pressure to sell treatments, push procedures, hit revenue targets. How do you teach them to pause? Put the patient first when the entire system around them is saying to do more, bill more.
See now, when they are students, so they are see every student. I'm sure even in other professional courses also they do have, and they do have a quota. That means before they handle the patients, so they are supposed to train themselves on a model. Then we give them the patients. So even on the patient, they are supposed to do these many cases before they give their examination or before they get the final degree. So till their student life, they're always observed, monitored, and corrected if they're doing any mistakes. The moment they finish their the course, so they are out. So there is nobody to guide them and correct them. So whatever they have learned, and because they would have already spent about 5 years, and the moment they are out, they'll be always comparing themselves with others who are already earning, making money.
Yeah, but they would have spent 20 years to reach there,
Yes.
right?
No,
Yeah.
but the same graduates after, say, if you are comparing with an engineering degree, any their degree,
Okay.
they would be already earning.
Correct.
So these
correct.
guys, after finishing 5 years, they still have to start a setup,
Correct.
and they have to again invest lakhs of rupees on a practice, or they have to work under somebody. So that
Correct.
is when the greed part would set in. They start thinking, oh yes, I have to start making money. So whatever they have learned as a student, the ethics, all that. So that part takes a backseat. So most of the unethical practices they would start during that phase. So that is the time where we need to, because before they step out of the institution, so see, luckily we tell them it is whatever curriculum they are in, they are learned. So it's the culture that gives, which molds them, not the curriculum. So when they are the students, we try to bring in those values. Yeah. So without that, I don't think there would be a good doctors in the society. So we, as much as possible, we try to, along with the curriculum, we try to, bring in these thing values in them, so that they don't do these unethical things. And it's not, how many cases I did or how many cases I do. Whatever procedure they do, was it really necessary for that particular patient or a particular tool? So that is when they need to value that.
I don't know if this is a myth or something, at least in the TV series that we watch, right? Grey's Anatomy, I think everyone takes the little bit of information from there. So they always say you shouldn't, connect emotionally with your patients because it becomes very difficult. So I see how it is, very difficult because you say that, keep your ethics, all of that in place, but again without getting emotional, without being connected to the patient, how do you try and be ethical, and how do you try and be true to?
See, you need to be empathetical. You need to be empathetical. See, when you don't put your values or ethics at the time, the right time when it is really required, and you, there is something running in your mind, thinking, okay, this, the, if a patient walks into you, I need to, you look at these many teeth, and okay, instead of doing a restoration, if I do a root canal, I'm going to make more money.
Okay.
Okay, so that part shouldn't be there. See, coming to the emotional part of it, see, you need to have that empathy. Yes, looking at the patient's background, looking at the teeth, the amount of damage what the which is taken place. So all these things has to be put in practical application. Then you need to give the treatment to the patient. So this is what I would say.
That's not a lesson, that's a whole TED talk in one answer. Okay, this is getting good. Let's keep going, Dr. Kumar. As Dean of BGS Dental College, what is one change you have introduced that you feel has actually moved the needle?
See, I've been into the practice for these many years, and I've been in the teaching. So, administrator part is one role which is the most challenging role. So, this is a new BGS is Balgangadhar Swamiji. Our Puja Swamiji is, we have about 500 plus institutions all over the country. So, for the first time, they have started a dental college. So, I'm grateful enough for giving me an opportunity there, because this is the first dental college they're starting. We do have about 3 or 4 medical colleges, but this is the first dental college they're starting
Under the BGS umbrella.
under the BGS group. So for them, they always wanted to start a college not for profit making.
Okay.
So they had always told, you have, when the student walks out of the institution, you have to make sure that there is something beyond the books they're going to learn. Okay, so with the same mindset, we are, because we just got the new set of students who have joined just about last year. So from the time when they have joined, our focus is not only the books, trying to balance it out so that whatever they learn from the books, clinical application and a judgmental part of it. See, they need to judge the decisions what they make, and they have to be responsible for that decision. See, if you don't hold them responsible for that, if there's no accountability, then there's no balance in it. So that is what we try to bring in those changes.
And also the ethics and the empathy
yes,
that
yes.
you were talking about, the
And
soft skills.
even the team of doctors, what we have, the teachers, what we have. So this is what I've been telling them. So even when you're taking the classes also, so
Okay.
always make sure that in every class there is something which about ethics, and that has been taught to the
Correct.
kids.
Yeah. Ingrain it in them
Yes, yes.
at a very young age.
Yes, yes,
Yeah.
yes.
And I even feel that if the child is like pre-prepared
Mhm.
before it goes into the actual world of working, as how the world is going to be, how the practice is going to be, how things may change, how you have to stick to your values and principles, I think it'll be a smooth run for them. Because once they get, it's very easy to be in a college under somebody and learn all the skills, but once they are independent out into the real world, that's when they get confused. So if you show the child this is how it's going to be, this is how you can manage, so I think those are the things they're trying to build.
Reshma, now I want to come back to you because there's part of the story that's about the families you serve. Your clinic has served families across generations in Bangalore. What keeps them coming back, and what's the most meaningful feedback you've ever received from a parent?
I think it's the way the whole journey is handled. The minute they enter the clinic, the doctors are friendly, they're approachable, they're given detailed treatment diagnosis, plan, methods, options. See, because that I think that's the main thing, the options, because you can't say this is the only thing that you can get done. So to make them, then they'll be like, how will they trust the doctor? Give them options. If I do this, what happens? If I don't do this, what happens? What are the other places of treatment or whatever? All that, those things, choices they give. So I feel that, and our front desk staff is very supportive, very friendly, and we give them the advanced treatment methods, and so I think all this makes them confident, and they put in complete trust in us. So I think that's what is getting us going.
Is there one feedback that you even remember now?
See, every day there's a new feedback. So, but generally what we've seen is not from the parent, actually, the child. So because they're so happy, they have that broad smile, genuine gratitude, and they always have some like handmade gifts for him.
Yeah.
Oh, yeah.
So
So-
they always come back. So uncle, I got this for you. I got it
Yeah.
made for you.
Oh, how
all those
sweet.
So they
So-
themselves write. So there's
Okay.
young kids who can't even, spell properly or whatever.
Correct.
But it shows how grateful they are.
I'm sure you have a big award wall in your
Oh,
clinic,
yeah.
Dr. Kumar.
Yeah, every time he comes with a pebble, he comes with some card, so
That's-
many things. And I'll be like, what is this? And so cute, it to Dr. Kumar, uncle, it starts.
I think
So-
that makes up for all that stress and
Yeah, see,
mental pressure that you would go through,
Yeah,
right?
see, the moment we finish with the procedure, especially when a child is apprehensive, when they're walking out, the moment they're getting down from the chair,
Mm.
the first thing I would ask them is, do you like balloons?
Okay.
So the moment I ask that question, you can see the surprise.
Change.
Balloons in a clinic, who can keep balloons?
Yeah.
And the moment I pull out a balloon and I blow the balloon and I give it to them,
Yeah.
you can see the change in their expression. Oh yes, I got a balloon. So that is one thing which will
Keep you
prompt us,
going.
keep us going. Yes, when the child comes back, because we'll always find, okay, last time what the child had got, which gift we gave, and we
So you
always
would
find
give something.
yes, we have to give
Mhm.
something.
So do you even track that, Reshma?
Track that, yes, of course, he's in Chickpit.
Okay.
Because he has to buy everything in bulk, from balloons to erasers to smileys, and so yeah. Another thing we have, surprising part is we have video calls.
Okay.
The parents showing us, the child wants to show you how I brush my teeth.
Okay.
See, I've done it today.
Oh, how
Or
sweet.
all that. So yeah, that's really nice, right? Those feedbacks, or just the general change in the
Yeah.
child.
Pushes you to
Yeah,
do more
exactly,
for them. Yeah,
exactly.
yeah.
And you always find, okay, what next new which I need to bring in.
I know exactly. If I've been coming to you for last 6 years,
Yes,
then
And we have kids recommending their friends.
okay.
So a friend, I think, he gets many like that, saying that, uncle, you treated
my friend.
my friend.
Mm.
He told me, and that parent is like, yeah, we stay so far.
Okay.
And but because this child in school went to this particular doctor, even my child wants to go to
Come
that
to you.
doctor.
Okay.
So children do influence, and as he said, they're the most loyal patients.
Yeah. Dr. Kumar, this question is for you. You treat special needs children. That takes a completely different kind of patience and approach. What has this work taught you that nothing else in your career has?
See, when you're seeing any other, because we call these special kids, because you need to always give that extra time. Usually, when we are seeing these kids, I usually don't see anybody else. So they have given a separate timings where I don't have to rush up. Yeah, I don't have to rush up. So I will always make sure that either they're seen very early. They would always be the first patients to see. So I wouldn't want to club them with any other appointments, because they don't want to be, because everything is new to them. The clinic environment is new, the doctor whom they are seeing is new, everything would be new, and they don't want too many people around. So that is one thing we always follow. And the biggest challenge is, see, when we, even after any other pediatric patient, when we make them sit, we take about 5 to 10 minutes. I usually take about 5 to 10 minutes to get into to doing the procedure, because by the time I would have assessed the behavior of the child and I would have done some amount of modification. But when it comes to these special kids, it's not that so. So many a times walking on with the parent and making them sit on the chair itself, that itself is an achievement for us.
Oh my God. Okay.
So most of the times that's how it is. So the next challenging part would be to have a conversation with them. I most of the times, I would say about 90% of the times, these special kids are handled in the general anesthesia because of the limitations what they have. But I would always want to treat these child on the dental chair, because for us, if at all, if even if there's a 5% chances for a child to cooperate and to get treated, I wouldn't want to take these child under general anesthesia, because that is where our specialty comes into the picture. Because we see, the moment you take the child in a general anesthesia, it's as good as you are doing a procedure on a model or a mannequin.
Exactly.
Yes, we don't want to do it. So we want to modify or do the certain modification in the behavior of a child, and see if there is a possibility. There are times where after treating the child under general anesthesia, almost 70% of them I'm able to treat chairside. Okay, so either a general examination or a small procedures like a cleaning or a restoration. So we are able to do all that. So the complete, when we take these child in the general anesthesia, it's a complete full mouth rehabilitation. We right from the simplest of restorations to your extractions or a root canals, everything is done at one shot. So
So based on the extent of work you
based on
decide.
the extent of the work.
It's time for the Sahasra question, and this one goes deep. Both of you all could answer this, or Dr. Kumar, you could take this. You spent 25 years building Smile Care together. What has kept this practice alive and growing through all the changes in dentistry? What changes have you adopted in your practice?
See, going with the trend, so dentistry is evolving itself right from the time where you drill and fill, or if you're not able to fill, pull it out. So that's how dentistry used to be. And from there, we have evolved ourselves, or the dentistry evolved itself as minimal invasive. So it's no more drilling and filling. So you need to conserve as much as possible. So with minimalistic approach, so with a minimal drilling, so we have advanced ourselves with microendodontics. So our clinic has been equipped with microscope, which is the most advanced thing what is available in dentistry. So we do have a microscope where in a microscopic level you can go and do the procedures.
So there is accuracy.
There is accuracy. You can really see where exactly you're, because most of the times certain procedures are blind procedures. So the experience, whatever experience you have, so you work on that. So, but this is, you can actually see it in the microscope in a magnification, and you can see what exactly has happened and how do you handle it. So that is one thing which we have brought in. And in my pediatric practice, because kids are most of the times they are either anxious or apprehensive, so we brought in new equipment called as a conscious sedation. So it will try to ease out, it's which is something called as laughing gas. Okay, so it will ease out. So once the child is comfortable with that, so you'll be able to do the treatment, and it's not necessarily it has to be with the child. So initially it was planned to use on the kids, but literature has showed no, even adults are the ones who requires more most of the times. So we do have it. And there's one particular patient which the patient was from US. She never got a scaling done because of the anxiety, because it used to make this vibration and noise. So the moment I mentioned it, you need to get a cleaning done, she said, no, I don't want it. When I gave her the option, and she wrote in the review, I don't know why, back in the dentist in US, they did not recommend this. I would, every time when I come to India, I would like to get this scaling done with the conscious sedation.
So, all right, we've gone deep. Now let's have some fun. There is this off the cuff questions, and there are no wrong answers. I'm going to throw some this or that. Both of you can answer, or there is also this finish the sentence segment. So, can we start with this or that? Tea or coffee?
Coffee.
Tea.
Okay, that is just opposites. Plan everything or wing it?
Wing it. I can't plan.
I think
I've done
I-
enough
I-
planning.
For me, things has to be planned. Things has to
exactly.
be
Yeah.
planned.
Enough planning goes
Yeah.
on in the clinic, in the house.
Yeah.
So wing it.
Vacations in the mountains or by the sea?
Both
Mountains. I would prefer mountains.
both are fine depending on
Yeah.
the mood.
So obviously, so I cannot leave her and go. So obviously, wherever she decides,
Yeah.
so I'll have to go.
So I think one vacation is to the mountains and
Mountains
one
and to the
vacation to
beach.
the beach. Cook at home or eat out?
Eat out.
Cook
I
at
knew
home,
that.
Cook
How
at home.
about you?
Cook at home.
I think every man says cook at home and every woman says
Yeah,
eat
because
out.
see that's how. See, if you want to win a man's heart, that is through the stomach.
Yeah.
So the best way is cook at home. Then you can win his heart.
So after winning is the question.
Yeah.
Morning person or a night owl?
Night owl.
Morning.
So now let's finish the sentence. Dr. Kumar, you first. The first thing I do when a child starts crying in the chair is
Make them put them at ease. Just asking questions like your name, as I told you, which school, friends.
so the balloon
hobbies.
comes later.
Balloon comes later. Balloon comes while going.
Okay.
So not in the
at the
first-
beginning.
Yeah, not at the
Do you want to switch it up and see if that makes your life easier?
Oh no.
You can't play your cards all at once,
Yeah.
right?
Because when they're going, usually when they're going back,
Okay.
that's when that's what your curriculum also says.
Okay.
So contingency, we do
Okay.
learn a lot about that.
okay.
So it's called as a contingency management.
okay.
So it's always should be given while the child is living.
okay.
So that is when you need to give that.
Involved.
Yeah.
Reshma, this is for you. The thing about people don't realize how difficult to run a clinic.
The whole coordination process, that smoothness that has to go run through, because once the patient sits, everything has to be ready.
Dr. Kumar, if you could go back and tell your younger self one thing, what would it be?
Probably work little more harder than what I've been doing. So I was.
Then there's no time for us. Don't
So
say that.
I was a bit eased out and kind of lazy
Okay.
in my initial days.
Okay.
So only off late, probably after marriage, I started pulling
So
myself
don't worry,
down.
Reshma, this is before you
Before
are married.
marriage,
Yeah.
yes, definitely.
So his dad wanted him to be an engineer,
Okay.
Yeah,
and he tricked him and got into dentistry.
Dentistry. Okay. So this is a signature closing question. If you would leave the flow community and all the entrepreneurs and leaders and everyone who has tuned in with one line, one thing to carry into the week, what would it be?
See, there's a saying: your face is your index of your mind. But I always stick on to this. So your mouth is the index of your body.
Okay.
Okay, because anything goes into your body, it has to travel through the mouth. So your oral cavity reflects how good your general health is. And there is always on golden rule, 6 months rule. Every 6 months, whether you like the dentist, whether you don't like the dentist, visit your dentist.
Thank you, Dr. Kumar. Reshma, would you like to add something to it?
I think he's added most of the points there.
Thank you, Dr. Kumar, Reshma, for coming over. I hope you had a great time here.
Thank you,
Thank you
Subhashini.
so much.
We did have a
Subhashini.
great
We had a
time.
great time.
That was Dr. Kumar, NC, and Reshma Kumar, a pediatric dentist, an academic leader, a clinic builder, and a partnership that's lasted 25 years and counting. This conversation doesn't end here. Share it, tag us, tell us which part hit you the hardest. Subscribe so you're always in the room when it gets real. This has been Flow Bengaluru's Beyond the Bio, proudly presented by Sahasra Property Capital. See you next time.